po si Ian Grace Mayorga from Cavite State University Main Campus. And I am going to be your student nurse for today. Kayo po si
Neil Bryan po.
Neil Bryan po. Ilang taon na po kayo, sir?
16 po.
Kailan po ang birthday niyo po?
October 24 po.
October 24 ano po?
2004 po.
Okay. So, ano pong gusto niyo pong itawag ko sa inyo, sir?
Bryan na lang po.
Brian. Okay, Sir Brian. So, today's assessment is about your male genitalia and rectum. So, this assessment requires me to touch you po, sir. Is that okay with you po?
Yes po.
Okay, so since this is a very sensitive assessment, I provided you a witness so that maging comfortable po tayo sa isa't isa. Is that okay po?
Opo.
Okay, so I provided you a cover po so that I will only expose the area that I will assess. So, once I leave this room po, sir, you can change na po. You can remove your clothes and also your underwears so that we can clearly assess your private part po. Okay? Is that okay with you po?
Okay po.
Thank you po, sir. So, sir, we will going to perform this assessment so that makita po natin kung meron po bang mga abnormalities with your genitals po and kung meron po bang mga presence of lesions, swellings, and any bulging or masses po. So, currently po ba, sir, may mga nafe-feel po ba kayo or may nararamdaman po kayong pagsakit po sa inyong genitals?
Wala naman po.
Wala po. Meron po ba kayong problems in your bowel movements po or sumasakit po ba ang inyong puwet kapag dumudumi po kayo, sir?
Hindi po.
Okay, so regular naman po ang inyong pagdumi po.
Opo.
Okay, that's good. So, at your age po, sir, so I expect po na meron po ba kayong active with your sexual life po, sir?
Wala po.
Okay, so hindi po. So, that's good po. So, imagine that my patient is in standing position. So, okay, his genitals is positioned in this level. Okay. First is we will going to inspect your penis, sir. Your pubic hair. Okay, so I can see that your pubic hair is evenly distributed. Okay, and there is no presence of parasites. Okay, infestations, and that's normal po. Okay, next is we will inspect the skin of your shaft here. Okay, it's non-tender po, sir. And usually po, okay, so it is also hairless, and usually po, it is free of lesions, and I can also see that there is no lumps with your shaft po, sir. Okay, so next is we are going to palpate it. It is non-tender, and usually soft po, and also in non-erect state po. Also, we were going to inspect the foreskin. Okay, so the foreskin is has the same color as your penis. Then next is we will inspect your glands for the size. So this is the glands. Okay, so it is pointed and free of lesions and also free of redness. Okay, so nagpatuloy na po ba kayo, sir? Okay, so I can see naman po. Okay, next is we will palpate for the urethral discharge. Urethral discharge. Okay, so there is no urethral discharge and that's normal din po, sir. So next is we will assess the scrotum. So your scrotum is here. Okay. Okay, so I can see that your scrotum hangs at the level of your penis po, sir. Okay, so nakikita po natin. The next is, I can see that there's no presence of swelling, bulges, and any redness po with your scrotum. And it is also crinkled and slightly darker with your than your penis po, no? And also it is normal din po na medyo umaabot po yung ating yung inyo pong pubic hair sa inyo pong scrotum. Okay. Okay, so at your age po, it is slightly crinkled din po, sir. Next is we will going to palpate for the scrotal content. So here, yung scrotum po natin, and we will going to palpate here. Okay, so I can feel your testis po, and it is in ovoid shape. Yes, and then equal in shape po. And also, does it hurt po, sir?
Hindi po.
Okay, so it is free of nodules po. And also, the epididymis is non-tender and smooth, and it is softer than your testis. Okay, so we will not be going to trans-illuminate your scrotum or for the sacral contents since there is no presence of swelling naman po. Okay, so next is we will assess your inguinal area po, sir. Here. Okay. Inspect your inguinal and femoral hernia. This is your inguinal area. Okay, so there is no presence of lesions po. And also it is free from bulges. Okay, so assume that my patient is in sitting position. Yung parang nagkakaroon po siya ng bowel movement while I am inspecting for her femoral area. Here. Okay. Okay, so upon palpating your inguinal and femoral area, there is no bulging or bulges and masses po with it. And then next is we will inspect and palpate for the your scrotal hernia. This po. Okay, also there is no presence of bulges din po, sir. Okay, next is may I ask you, sir, to turn around so that we can assess your anus and perineal area po. Okay. Okay, so upon inspecting your anus and perineal area, it is hairless, moist, and tightly closed din po, sir. Free of redness, and wala rin naman po tayong nakikitang lesions and any rashes po. Ano po? Okay, so next is we will inspect your sacrococcygeal area for swelling and redness. Okay, there is no presence of swelling and redness din po, sir. And also your rectal prolapse, sir. Can you do a Valsalva maneuver po, sir, by putting your fingers with your two nostrils and then your mouth with your mouth closed, and then breathe with your ear po. Yung lalabas po ang inyong hangin sa tenga po natin. Okay? 1, 2, 3. Okay. So upon assessing your rectal prolapse po, there's no bulging or masses, and also there's no presence of hemorrhoids po, sir, while you are doing the Valsalva maneuver. Okay, so next is we will going to palpate for the anal sphincter. Okay. First is I will going to lubricate my hand. So I'm going to use this as a substitute to lubricate my gloved hands po, sir, as I am going to insert my finger in your anus. Okay. I can feel that your sphincter relax. And as I can insert my finger, okay, so this is normal po. Kapag na-enter ko po ang aking finger in your anus. Does it hurt po, sir?
Hindi po.
Okay. So, next is we will going to palpate the rectal mucosa for the tenderness. Okay, the rectal mucosa. I can feel that it is smooth, non-tender, and also free of nodules and hardness po. Also, your peritoneal cavity, free of nodules, and it is non-tender po, sir. And then, your prostate gland, I can feel that it is rubbery, non-tender, and smooth din po. The next is we will going to get some portion of your stool. Ma-inspect po natin ang inyong stool for the presence of blood. Okay, so as I can see po, sir, your stool is normally semi-fluid and also free of blood po. Okay, so you can turn around na po ulit, sir. Okay, so thank you for your cooperation po, sir. And I assure you 100% privacy po, sir, since as I was documenting the findings,